Okay guys, here's another small video I created, and just bear with me. Some of you probably don't like these at all, and then others may appreciate them. I'm a visual learner, but the main thing is that I've always wanted to try to create a small video that looked like something you would find on Khan Academy, because I feel like it's so cool. Anyway, so I finally found the software. I have like 5 different pieces of software to create this and then add it to the lecture. So at least you know I'm working hard to educate you guys. I just hope it works. So here we are. We're talking about IMV versus SIMV and the differences you may see in the OR when you're using these 2 different methods. So with the IMV, it's intermittent, and then with the SIMV, it's a synchronized mandatory ventilation. So as you can see, both of these pressure waveforms look pretty similar to each other. There's no real difference. So let's differentiate which one is which. So the IMV and the SIMV are these 2. So IMV's on top, SIMV's on bottom. What I want to do is show you what happens when your patient may be getting a little light and tries to take a spontaneous breath during the surgical procedures. So here, these little blue half circles are trying to display a spontaneous breath taken by the patient. So in the IMV mode, these spontaneous breaths can occur, but they're not supported at all by this particular ventilator mode. So that means the patient, although they're asleep, if this was like an ICU patient that wasn't sedated, they'd feel like they're breathing through a straw. Their respiratory muscles would wear out pretty quickly. It wouldn't be comfortable at all. Whereas in the SIMV mode, with each spontaneous effort, the ventilator provides a small amount of pressure support. Now, it doesn't necessarily change anything because they're still in this mandatory ventilation setting, but it will give them some pressure support, making it more comfortable for them. And then further down the line, once the patient starts to come around, which I love SIMV during procedures, because if the patient tries to take a breath, this is what's going to happen. So SIMV is really awesome because it provides pressure support, and it is smart enough to know when a patient takes a big breath, it's not going to force in that mandatory volume during the patient's effort, meaning the mandatory volume will still be delivered, but it's going to come either at the begin or the end of the patient's effort. So it's not going to cause them to cough or buck, which is why I love that. Now, like on a volume controlled, pressure controlled, or IMV, if they try to take a big effort near the end of the case, they're always going to start coughing and bucking on the ET tube, which then the surgeon will scream at you, "The patient's awake." So I love this during the operative portion. If the patient can breathe spontaneously through the whole case, I'll just set a really low rate and let them breathe over the rate. However, when it's come time to intubate, I'll take them off this SIMV mode and just take them off the ventilator and let their spontaneous respirations take over. Okay, so let's talk about what happens when the patient in the IMV triggers a large breath. What happens to these patients? So if they trigger a breath and the mandatory volumes delivered on top of that breath, you get something called breath stacking. And breath stacking, if it happens once, it's probably not a bad deal, but if it happens to anyone with COPD, emphysema, or any other restrictive lung disease, it's going to turn out to be really bad, and it can cause a patient to code if they're sick. So what happens is during the exhalation phase, there's not enough time to expel all the gases out of the lung. So when the next inspiratory phase takes place, it's forcing more gas into the lung on top of the gas that was left in there from the previous breath. And eventually you're going to have a huge lung volume, increased thoracic pressure. You could potentially have a hypotensive crisis on your hands. If they have bad lungs, you could even create a pneumothorax. So IMV is kind of going out of favor. There's much more advanced settings than SIMV, but I personally like it. There you go.